Hi, this is Dr. Rukmani Chaudhary and you're watching Dr. Rukmani's Health Update. My today's topic is edema, swelling, inflammation. So in today's topic, I'll be talking everything about body swelling. Like why you have swelling, what are the causes, risk factors behind this, signs or symptoms you have while having swelling or edema. Diagnosis, the required test, the basic test required test, and prevention part, how you can prevent this condition. Best effective homeopathy treatment and treatment in allopathy. So I request you to watch complete video for complete information. If you're watching first time, share and subscribe my channel for further notification. If you want video and voice consultation, drop a message on given below WhatsApp number. You can avail video and voice consultation. So let's begin. Swelling. Edema is the medical term of swelling. And swelling is a kind of the fluid retention or enlargement of a particular area after any infection or inflammation. There can be fluid retention, there can be organ enlargement. This can be internal swelling and external swelling. There can be some internal causes and there can be some external causes. This can be like localized, associated with particular part, like this can be eye swelling. This is like localized, and this can be generalized. Means you can have all over body swelling. So this can be localized, generalized, this can be external swelling and can be internal. Let's talk about the causes part. Why you have swelling, what are the causes behind swelling? There are variety of causes, there are couple of causes, like these are after infection. You can have a certain kind of infection and after that you can have swelling. So after infection, after injury, even any kind of trauma, injury lead to swelling. This can be physiological swelling during your menstrual cycle. So during your periods, you might even feel that like there is a fluid retention. So this is like physiological swelling during your period cycle, and during pregnancy as well. This is again a kind of physiological swelling, and after this subside usually. So the infection, after injury, and this there can be certain allergic reaction, aggressive allergic reaction, and these are called anaphylactic reactions. These are very emergency and you are given anti-allergic. These are like external injury causes. They can be trauma, injury, infection, menstruation, pregnancy. These are like external causes of swelling. Now what about the internal causes? There can be the failure of certain organs, like there can be kidney failure, there can be liver problem at times, liver infection, liver enlargement, and there is heart failure. So these are the internal organ causes. There is a malfunctioning of these organs lead to swelling. For the sign or symptoms part, you are having swelling, but at times it is invisible. So in these kind of cases, if it is internal and it's not visible, so there are certain signs like you feel nauseatic, there is a nausea, vomiting, and there is dizziness and fatigue and fever at times. So these symptoms are associated with internal or invisible swelling. And the diagnosis part, so diagnosis is made by collecting all your the history, all your symptom, your present symptom, what was your history, what all your symptom you had. So it's like collecting all your history. So there is physical examination, physically viewing whether you are having tenderness, the painful or not. So physical examination is there, routine blood tests are, these are kidney tests and liver function tests, and urine examination is done, and imaging tests are done. The CT scan, MRIs, they usually gives idea about the internal tissues structure, like your muscles, your arteries, venous blockage. These did with the help of imaging test, CT scan and MRIs. Rest depends on your symptom, what particular symptom you have. About the treatment part in allopathy, see, treatment entirely depends on your cause, what is the underlying cause, and accordingly. So is there any problem in your kidney function test, whether your kidney is affected, liver is affected, or are you allergic towards certain medication, or is there any kind of infection you had? So your history is taken, your all symptoms taken, and accordingly there is a diagnosis and accordingly there is a treatment. About the prevention part, yes, in swelling cases we always recommend you avoid salt. Avoiding salt helps you cause salt always accumulate water. There is a fluid retention due to excess salt. So just limit or just avoid salt in your diet, and avoid even sour items in early morning or late evening. Just avoid these things, and just wear support. Elevate your feet or even elevate your arm above your chest. how homeopathy helps and how what approach homeopathy has in swelling area. See, we do focus on the cause, that what is your case and our underlying causes, but same way we have to collect all your symptoms, what other symptom you have, what other suffering you have, and we have to collect all your data, your history, duration, character of swelling, whether the swollen area is the cold or the warm, or are you having the pain, you are lethargic, drowsy, or you are restless. These symptoms matters, and these symptoms help us in homeopathy to select, or we call it like similimum. Medicines these are like homeopathy medicine only available homeopathy pharmacy store. Link are given in the description box below, so you can check and you can buy medicine from there. So phosphorus in homeopathy is given when your liver is affected. There is a liver inflammation, enlargement, infection, hepatitis, even in kidney problem. So if your liver and kidneys are affected, you can take help of phosphorus, like 30 or 200 potency, 1 or 2 drops directly on tongue. Medicines, all the medicines are having dropper, and the color, it's company's color, you can even get a different color and different form of the medicine. So just buy the focus on the medicine's name. So Leadenpal is the medicine in homeopathy that is given after insect bite. So if you have insect bite and after that there is a swelling and the swollen area is cold, different color, so in that case you can take help of Leadenpal. Same way, 1 or 2 drops direct on tongue orally before having your meal for 3 times in a day. Apis mellifica is almost specific. This is almost specific, and this is given there is a burning, there is burning, pain, and swollen, and there is a heat. So in these kind of cases, Arnica montana. So arnica is given when there is an after injury. So in the case of injury, you had an injury, and after that this can be head injury, this can be muscular injury, internal injury, not lacerated one, no internal injury like hematomas are found in arnica. So in these after request German homeopathy medicine, inflammation. If you have acute inflammation, means there is a pain with swelling. So in these kind of cases, you can take help of R1 with some water, like 10-15 drops in some lukewarm water 2-3 times in a day. Don't use all medicine, these are according to case. So just use according to your symptom. This is dropsy, this is like organ fluid retention. This works amazing. So this is again for 5-10-15 drops in some water. This is tablet form. When you have fever, tablet form, 2 tablets or 1 tablet 2-3 times in a day before having your meal. This video can give you some amount of help. If you find this video knowledgeable, informative, please like, share, and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much.